Taiwan Central Epidemic Command Center previously predicted that the peak would be on September 21st or 28th, but the confirmed cases are actually higher in October. What can we tell from the numbers?
I think predicting the peak, the timing of the peak, and the number of the cases at the peak time is very difficult. This kind of prediction is at the most being used as to help people or help the government prepare for the worst case scenario. So I think we should not kind of over interpret the results of the interpretation and or the prediction, and what is going to affect the timing of the peak and the size of the peak is a number of factors. I think for the current wave of outbreak, there is still a certain period of time that we're going to experience this level of outbreak. It's not going to finish or end anytime soon.
Is it possible that people are underreporting as is in other countries? How confident are you in these official numbers?
There are countries that have been changing their reporting behavior, for example, like more towards more severe cases, and also the efforts that the government or people spend in reporting probably varies hugely across countries. So I think comparing the number of confirmed cases per capita across countries at this present stage is probably not the best way of understanding the severity or the level of severity for COVID-19. You can probably look at, for example, the number of hospitalizations or the number of COVID-19 deaths per capita. This is more comparable across, although there's issues of how different governments define a death is COVID-19 or not. Different countries may have some different practice, but at least I think mortality is probably a better indicator than like daily number of cases, confirmed cases.
So going forward, what COVID prevention measures can stay and what should be loosened?
This has to be dynamic over time, because we don't know what like the future variants is going to do to us. But I think for now, if we focus on the Omicron, people are now getting used to testing, self-testing, reporting, and isolation. So I think we can gradually, taking the experiences from other countries. For example, Japan has actually never done any mandatory mask wearing policy. It's all voluntary. So I think kind of moving back to a more voluntary basis, spontaneous way of prevention and control is probably, for now, is the way to go, and making the like quarantine or the isolation less burdensome is currently still a burden to the public health officials in many places.